Hey, what's up guys? It's Victor from Cyborg for Life. Hope you guys have been awesome lately. Now today I want to talk about a highly debated topic surrounding limb lengthening surgery, and that is regaining your athletic ability after the procedure. Now this is a loaded topic, and there's a lot of typical factors that play into it. Things like how much length you got, how much effort you put towards your physical therapy rehab, how much your biomechanics are going to change after the procedure, how good was your nutrition, what type of procedure you got done, was it cosmetic or limb length discrepancy, lengthening, and then how much time you gave yourself to recover. Okay, now before I begin, I actually want to kind of ask the question, what does it mean to regain your athletic ability? Well, it's going to mean different things for different people, right? So for some people, they might want to regain their full strength so they can squat as much weight as they did before the surgery, whereas others may just want to be able to run, jump, and do other activities requiring agility. And then you might have other people that just want to be able to do basic tasks around the house. Okay, now I do want to mention that technically you're not going to be the same after limb lengthening surgery as you were before, but it doesn't necessarily mean you can't do the same things. Okay, it's kind of different. I'm going to explain as we go. All right, now recently I've spoken to quite a few limb lengthening patients currently going through the process, and so a lot of what I'm going to say is based on what they've told me. All right, so the first factor is whether you lengthen conservatively or you push things to the max. Now I consider conservative femur lengthening between 5 and 6.5 centimeters, and extreme femur lengthening between 6.5 and 8 centimeters. And this is assuming that you have the internal stride nailed. I'm just gonna set those standards. And then if you're tibial lengthening conservatively, that's between 3 and 4.5 centimeters, and extreme tibial lengthening between 4.5 to 6 centimeters. Okay. And most people know that it can be easier to make a full recovery if you lengthen conservatively, but some people want to walk that fine line and get as much length as possible without jeopardizing their physicality. All right. Now, what's the deal with pushing a centimeter or two past conservative? Well, for one, if you max out the reserve slack in your muscle length, things can get very tight and impact your active range of motion, and then impact things like your knee and hip flexion. Like hip flexion is bringing your knee to your chest, and knee flexion is like bringing your heel towards your butt, okay? And these can restrict things like making a deep squat harder for some time. And you might be thinking, well then, I'm going to lengthen my tibias so that I don't have to worry about tight thigh muscles. And unfortunately, it doesn't really work that way because you have the posterior kinetic chain that's all connected, right? So if you lengthen one limb and their muscles are affected, the limbs and the muscles above or below are going to be affected as well, okay? And from the patients that I spoke to, they all say that the last centimeter or two is downright brutal because of the tightness in the muscles and the soft tissue. But even though they experience some pain and discomfort, things like their knee because of tight IT bands, even though they had releases in their IT bands that would regrow and whatnot. And then if they're trying to do knee flexion and they're tight, that's because of the taut hamstrings and the calves. They find that if they're diligent on their physical therapy, they feel they're going to be able to get their old abilities back. Which brings me to the next factor, which is physical therapy rehab. I mean, how serious you take your physical therapy rehab is one of the biggest proponents. And, I think a lot of people misunderstand this aspect of therapy, and I'm not going to go on and be all preachy too much about it today. But if you simply go through the motions of therapy and you're not intentionally pushing yourself to regain your range of motion, your strength, your overall function of your limbs, then you might get rid of the lingering surgery symptoms, but you're not going to get your athletic abilities back, because physical therapy and rehab is like that is limb lengthening surgery, okay? The surgery, yeah, you got to pay for that to get the rods in there or whatever, but if you're not doing rehab, then you're not lengthening that tissue and you're not going to walk, okay? In fact, one of the guys that I spoke to who's doing internal stride nail lengthening on his femurs, who's approaching 8 centimeters in the next 2 weeks or so, he's going to be wrapped up. Basically, he mentioned that he's doing 7 days of rehab, guys. He tracks his steps and he's doing anywhere from 5,000 to 7,000 steps per day. He's focusing on a good diet with high protein intake. He's constantly working hard to rebuild his muscle strength, especially in the glutes, because you lose some muscle from being out of action for a while. And that can cause like a funny waddle to your walk. But he said, Victor, I basically asked him, I said, do you think you're going to be able to make a full recovery? And he said, Victor, the mindset is more important than anything, okay? The mind can be your greatest asset or your greatest enemy. And I love that little quote that he said, and I 100% agree. The more you put into rehab, the more you're gonna get out of it, okay? I did the same thing for my limb lengthening surgery. Guys, it's all about that mental manifestation, okay? And the good news is most of these patients that I've spoken to, they believe that they're gonna make a full recovery after their procedure, okay? Yeah, they have expectations that they might hit a roadblock or a hiccup here and there and have to push through it or wait till time takes its course. But, you know, they're saying that because we're faced with tons of disciplined rehab for limb lengthening, when we're healed, we're gonna take that same mindset and work ethic, okay, and work harder and thus end up being able to do the things that we did before the surgery, okay, regardless of if we lengthen conservatively or extreme. Now, like I said, conservative lengthening is almost a guarantee you're gonna be able to recover 100%, no problem. But they're saying that if you have a strong mindset and you're willing to work like crazy, you could still recover if you maxed out that nail, okay, for the femurs or went for like 5 centimeters on the tibia. So, and then the next factor is going to be altered biomechanics. Okay, guys. Now, this is a consequence of cosmetic stature lengthening, whereby the way you move your body and how much force you have to apply to move it, okay, is going to be different than it was before the surgery. Okay. Now, this isn't really a huge problem for the average Joe who just wants to get taller and, you know, live a normal life, get up, go to work, even do a soft jog every now and then. But when it comes to the advanced athlete, okay, guys who are willing to get under a squat bar loaded with a couple 100 pounds or play sports and do crazy stuff, it can be a huge deal. So without going too deep, when you lengthen your bones, you are altering the physics and the anatomical structure and thus the movement patterns of your body. And so how can this affect things? Well, it can make your balance feel a little bit off for doing physical tasks that require balance. And the good thing is that you can usually adapt pretty quick and pretty well to these changes. I'd say within a year or so, you should be fully adjusted. But to expedite this process, you can actually do proprioceptive training, okay? Things like balance training and whatnot, okay? In fact, the patient that I spoke to, they noticed, I asked them, you know, do you think that this is going to be a big thing? And they said that we notice it. We notice the difference, but we don't feel like it's something that's going to prevent us from regaining our athleticism, okay? Or balance to do what they used to do. So I'm going to use squatting, you know, with a bar on your back as an example. So, and femur lengthening. So to help explain the scenario, because you're going to probably run into it if you do femur lengthening. So a lot of expert kinesiologists believe that the longer femurs and shorter torso result in a forward lean, kind of like a low bar squat, engaging the posterior chain muscles like the hamstrings, the glutes, the lower back a little bit more than the quads at least. Now, this may make you think that before the surgery, if you squatted with a rather standard stance with a high bar position, okay, on your traps, you may have to sit your hips back to achieve the same depth after surgery. While this is somewhat true, if you modify by taking a wider stance and break at the knees first before the hips, you should be able to expect to be able to hit a full depth squat without excessive forward lean. Okay, even if the knees track forward a little bit, it's not going to cause too much shearing force because of the fact that the foot placement, okay, is wider, or your hip positioning is further back. Okay, because you're going to need maximal flexibility in your ankles, yes, but at least you're going to only have to worry about one or the other. The foot placement, the foot stance, like wide or close, or the hips go back further, okay? And at the end of the day, the only thing that really matters is bar path. It has to go straight up and down, okay? So as you can see, you're able to do the same thing even though you're not the same. It's just going to take time, okay? And then you have the factor of healthy nutrition, okay? And I've never really understood you know, why people who undergo as like a big endeavor such as limb lengthening don't take nutrition seriously enough. I mean, muscle strength is directly correlated to calorie intake, specifically protein intake. Now, if you want to get your athleticism back, you don't want to simply just eat to hold your weight, okay, or eat enough. You want to like eat to keep your to like maintain your muscle and prevent atrophy, because you know, the thing is that you want to be able to regain your strength faster after surgery. And besides like making sure you have an ample amount of protein, you want to make sure that you're drinking enough water, because water is a huge component of muscle tissue. So focus on a lower carb, moderate fat, higher protein diet. You're going to come out of leg lengthening surgery a taller, ripped beast ready to get your physicality back, okay? All right. So now we're going to talk about the types of procedure they might have done. So there's two main differences between limb lengthening for cosmetic versus discrepancy purposes, okay? Now, for cosmetic, it's to ease the psychological pain of having a relatively short stature, while discrepancy is to cure an actual physical problem and make both legs balance, okay? Now, patients with leg length discrepancy have to pay up front with years of pain and discomfort, risking long-term arthritis and muscular imbalances until they get the procedure done, while cosmetic limb lengthening patients are billed in the rears, okay? Like my little analogy there, all right? So they're more at risk for losing their athleticism after surgery, okay, than a discrepancy patient is. When it comes to regaining your athletic ability, both can do so, okay? But they have to give it enough time. Rehab, training, things like proprioceptive training and balance training exercises. And there's gonna be that adaptation period, but if you give it enough time, you'll get used to your lengthened limbs, okay? And then doing things like after surgery for a limb length discrepancy patient are gonna feel much better than it had in the past, and they're gonna feel much different for a cosmetic limb lengthening patient, okay? But again, they're going to be able to adapt within the 6 to 10 month time frame, or at least they should if they're doing things properly, okay? And the final factor is basically giving yourself enough time to recover, okay? You know, you got to give yourself enough recovery time, because if you don't give yourself enough recovery time, then, you know, you're trying to rush back to work or school, then that could affect how soon you regain your athleticism. Typically, you're going to want to be able to walk and have full active range of motion by 5 to 6 months post-op, and then gradually scale up from there. And you never want to rush your recovery timeline, okay? So the final question is, can you regain your physical athleticism after limb lengthening surgery? And I'd say based on the patients that I've talked to, and if you respect the factors that I mentioned, I believe yes, you can, okay? But a lot of people over lengthen, or they under rehab, or they just assume that I will never get back to doing what I did before, and what the mind believes, the body will manifest, okay? Anyways, guys, I plan to follow the patient's journeys, and I'll have a more deliberate answer for you in the future. But for now, I would say that, you know, if you want to be certain to regain your athletic abilities, you should lengthen conservatively, all right, unless you are a highly motivated person and you're willing to work hard and push when your body pushes back, okay? Then again, it really comes down to not trading off function for height. All right, guys, that's all I have for you today. If you found the video helpful, go ahead and hit that like button. I'm hoping to get a few interviews with some patients in the coming weeks, as well as some new videos, so be sure to subscribe if you haven't. And yeah, until next time, this is Victor from Cyborg for Life, signing out. Peace.